So, what do you think about when you hear the phrase invisible illness? Maybe you picture a ghost with a cold, sniffling and sneezing, and although that would be funny, the reality of living with an invisible illness is a far more depressing reality. So, today I'm going to teach you about the symptoms, the treatment, and a type of severely underdiagnosed invisible chronic illness called Ehlers-Danlos syndrome. So, as a whole, Ehlers-Danlos syndrome has 13 subtypes. But to save time and me from embarrassing myself by butchering multiple words, the most common types are classical Ehlers-Danlos syndrome, classical-like Ehlers-Danlos syndrome, and hypermobile Ehlers-Danlos syndrome. But today I'll be focusing on hypermobile Ehlers-Danlos syndrome, not only because I probably have it, but because hypermobile EDS is the most common type, with the Ehlers-Danlos Society saying that hypermobile EDS makes up for 90% of EDS cases. The EDS Society has said that hypermobile Ehlers-Danlos syndrome is thought to affect 1 in 3,100 to 5,000 people, but the true prevalence is unknown and thought to be more. Now, you may be wondering why the numbers are so questionable, and that is because EDS is a full body syndrome. It affects everything from your skin to your internal organs. So, at the core, EDS is a connective tissue disorder. As stated in the Ehlers-Danlos Society website, connective tissues are found throughout the body. They provide support, protection, and structure to the body. A connective tissue disorder is a problem within those tissues that prevent them from functioning properly. The primary component of connective tissues is collagen. So Ehlers-Danlos syndrome is caused by changes in the genes that affect structure and causes the collagen to make them kind of useless. So, now that you have some idea of what Ehlers-Danlos syndrome is, I'm going to highlight some common symptoms of hypermobile EDS. I have pulled this list from the NHS website. So, joint hypermobility is probably the most obvious one. So, joint hypermobility is defined as greater than average range of mobility in the joints. Kind of in the name, but whatever. I'm not going to show you a diagram because diagrams aren't the best learning tool when it comes to medicine, I've realized. So I'm going to show you on me instead. This does not hurt. So a normal person's finger probably bends to about here. If you push it back, mine bends like that. So that's one example. To my elbow. You see how it kind of goes all the way up, and I almost just fell off the chair. We're going to ignore that. I'm trying to think of another one. Oh, this one. Yeah, that's pretty obvious. So another one is fatigue. I am always tired, no matter how many hours I sleep, and I've run experiments where I've slept for 9 hours to like 3 hours to see which one feels better, and they all feel the same. Stretchy skin is another example. Again, I'm not going to show you a diagram. I'm going to show you on me, and again, I promise this does not hurt. So yeah, my skin comes a bit far. On my hand, on my wrist. This one might be a little difficult to see because of the lighting. And then on my elbow, and then my bicep. Yeah, and this is just my skin. There we go. That's a better one. So, another major complication of EDS is the likelihood that you'll have postural orthostatic tachycardia syndrome. I know I just rattled off like 20 letter words to you, but it's not that difficult. So they call it POTS for short. So if you don't feel like pronouncing that or you can't, POTS is a disorder where your body's autonomic nervous system, which balances your heart rate and your blood pressure, they can't coordinate those correctly. So basically, your body can't keep your blood pressure stable from laying down to standing up. So people with POTS pool more blood below their heart when they stand up, making them likely to experience dizziness, fainting, and exhaustion. Personally, when I shower, my legs pool blood, so my legs will go from brown to bright red. And when that happens, I have to sit down or I will faint. So I have to put a shower chair. So when that happens, I can just sit down, take a breath, and then stand back up because I have fainted more times in the shower than I would like to admit. Um, a statistic that I pulled from the Ehlers-Danlos News says that 80% of people with EDS experience POTS, which is really unfortunate because POTS can be a debilitating syndrome. So now we move on to treatment for EDS. Unfortunately, there is no cure since our foundation was built wrong. You know when like a house is tilted and because like a construction worker put a pole in the wrong place, you can't fix it unless you tear down the house. So in people terms, tearing down the house would mean death, and that's we don't want that. Um, but since there is no cure, there is still ways to manage it. So one of the best ways to manage it that I have found, and other will agree with what I'm saying, physical therapy. I have been in PT on and off for about 4 years. The last 3 years have been with the same guy, and he has helped me recover from surgeries, which I'll talk about later. He's helped me learn how to not hyperextend, which is just like pushing it to the far as it can go, because that's not good for hypermobile people. He's taught me how to hold myself better, so I don't put as much pressure on a joint and make it pop out of place easier. A good PT is vital in your success as a hypermobile or EDS patient. If you don't have a good one, find a good one because you're gonna need it. Me and my PT are actually really close now because of it, and it's a great relationship. So another way to manage is surgery. Surgery is a last ditch effort for hypermobile people because it will help, but it won't fix it completely. So, if you can see my shoulder, you can see scars. There's two here, and there's one on the back. There it goes. My shoulder was dislocating multiple times every single day. It was really painful. I couldn't even put on a shirt without it dislocating. So my surgeon went in and like the way he explained it was if you take extra fabric and you loop it and then sew it. I don't know if that makes sense, but that's what he told me. And then he fixed a few more ligaments in here because they were frayed from all of the dislocations. Um, I actually still have my sling. I had to stay in this bad boy for about 10 weeks. I've had my knees worked on because they were dislocating too. So you can see one scar here, one scar here, and then there's one right there. My right knee, same surgery actually, one, but then I just had another one. So there's two down here. I had that one in August of last year because from complications of my dislocating kneecaps. Surgeons, hold on, I forgot I have my brace here. So in the first two surgeries, this side bends, you see that? Because it's unlocked, but this side won't. So I had to walk around with my knee in a straight line because I could not bend it for the longest time. So my PT literally taught me how to walk twice. So a lot of surgeons don't want to work on EDS patients because, as I said, our skin is really fragile. So if you look closer, you can see those two, which is really long because my skin ripped from the stitches, and unfortunately that is common. So doctors will suggest lifestyle changes to help manage the pain, from a strict regimen of Tylenol and ibuprofen to braces that will help keep your joints in place, and light activity. Contact sports is not recommended, obviously. Do not do it. My PT says that like the strength side of yoga helps, not so much the stretching part, but like handstands or more dynamic movements. That's good because it will help strengthen you. So now, in conclusion, if you feel you have a lot of these symptoms, please don't panic. I would recommend talking to your general practitioner, but please note that it might take a while to get listened to, unfortunately. So, in fact, in medical school, students are told when you hear hoofbeats, think horse, not zebra, meaning that they'll try to diagnose you with more common disorders before they consider something as rare as Ehlers-Danlos syndrome. And that is why the Ehlers-Danlos syndrome is a zebra. I almost dropped it. Advocate for yourself. Advocate, advocate, advocate. I wish that when I was younger, somebody would have told me that. But now I'm telling you, so hopefully that will help you. Even if you don't think you have EDS, advocate for yourself regardless. And that is the end of me explaining an invisible illness that controls mine and many others' bodies. It's not a fun time. Steve is strong.